everybody. And this topic is something that's very close to home, as Jessica said. We've all had some challenging experiences over the last few years. And thank you, Roberto, for kicking us off in terms of introducing the broad themes that we're going to see in this conference. And in addition to what you showed, I think that all of the factors that are driving change in healthcare are digital, financial improvements, being able to transform the industry. And that, to me, is what I describe as the business of healthcare. But I also think that we should think and put as much attention to the business of healthcare to the social good of healthcare. And to help me do that, we have Lynna Chandra, who is joining me. Lynna is from Singapore, from Indonesia originally, lives in Singapore, and she will soon introduce herself. I describe her as a humanist. And Lynna will give you a definition as to what that means for her. But to give you a little bit more context on this session, the objective of what we want to have throughout the next 2 days and throughout the rest of our careers in healthcare is that we need a different mindset shift in how we are supporting public health and how we're supporting and addressing the needs of individuals around the world who are left behind. And the business of healthcare is working well and helping us to drive change and innovation and grow the industry. And unfortunately, right now, the social good is down here. And the call to action that Lynna and I will start to discuss here, but it's just a starting point, is how do we start creating greater balance? So Lynna, please, if you don't mind taking a moment to introduce yourself, that'd be great.
Thank you, Tony. Thank you for the kind introduction, and most of all, for the invitation to be part of this discussion on a topic that is so close to my heart, as you know. But first, perhaps allow me to share a story of why humanity and the need to restore humanity to healthcare is so deeply etched in my heart. In early 2006, I was in Jakarta and sitting down at a breakfast room of a small hotel, and armed with a double espresso, I was starting to just leaf through the physical newspaper, something that is so rare today in our digital world. Right at the bottom of the front page was a small article that caught my eyes. It tells the story of a man who was pulling a cart behind him, rushing towards the gate of a public hospital. That cart is a garbage collector's cart. This man is a garbage collector. But in that cart on that morning is a little girl, his daughter. He was rushing through the gate of the hospital, and he was stopped, but he carried his daughter and rushed to the front of the hospital and crying for help. A nurse walked towards him, took a look at the girl, and said, "Your daughter has died. Please don't leave her here." That article then went on to explain that this was the 7th hospital he had taken his daughter to that morning. Each hospital had turned him away because he did not have the money to pay for the deposit so that they would attend to his daughter. Those were the days before the universal health coverage. I cried for that man. I can't even begin to understand the devastation he must have felt as a father because he couldn't take care of his daughter. I cried for humanity most of all, and wonder, when did we begin and how did we get here? How did healthcare get here to a place where fees and remuneration dictate whether or not we respond to someone's suffering? That story became the underlying drumbeat of everything I started to do and guided the purpose and focus of my work from then on. And that later that year, when I built the first hospice for children in Indonesia, it became our primary focus to bring care to all those with little or no access to care, and with a guiding vision that no child should ever have to live or die in pain. We have since provided care for over 4,000 children and their families, and helping families through some of the worst challenges in their lives. But Tony, the most powerful impact, I think, is witnessing how doctors and nurses are willing to cross hot coals to provide care for children and for their families once their hearts are awakened. It made me realize then that within each of us is a human person that responds to another's pain and suffering with or without money. We simply need the permission to reconnect to that humane part of ourselves deep within our hearts.
Thank you, Lynna. What a wonderful story to help share with us the importance of humanity. Very touched by that. And since I started podcasting, as Jessica mentioned, I have a podcast series that focuses on personalized health, which is the transition of the industry from a one-size-fits-all model to more preventative care and focusing on precision interventions. And also my Digital Health Today Asia Pacific edition. I've met some other wonderful humanists like Lynna, people who have this focus in saying the industry is more than numbers. The industry is more than looking at the clinical trials and the data we're generating. It's focusing on the number of people and lives who we touch. And I think that's important to understand, that we can create that influence and impact. And I wanted to share another story, a video from one of the podcast guests that I had. His name is Shuchin Bajaj. He is based in India, and he has an incredible story of someone who had the opportunity as one of the top of his class individuals in medical school to make the jump from India and follow the path to personal gain and move to the US. But rather than do that, he decided to stay in India and take a harder journey to help people in need, to help make sure that no one gets left behind. So if we can show this video, please.
I was doing my super specialization in a very big hospital in Delhi, and a lot of my friends and family used to call me saying that somebody's had a heart attack or somebody's had an accident, somebody's very sick and they're bringing that patient to Delhi, and could I help them in any way? And sometimes they would never turn up. I would keep waiting for them, and then when I finally would get to contact them in the morning, I would get to know that the patient had died on the way, so they had to turn back and go back to their villages. I'm Shuchin Bajaj. I am the founder director of Cygnus Group of Hospitals. We are a chain of hospitals that provides emergency, tertiary, critical care to communities that do not yet have access to these services, and especially in conditions where the golden hour is of great importance, where you can actually lose your life if you spend too much time on the road while trying to get to the nearest big city that has these services. We have 10 of these hospitals, 7 in Haryana and 3 in outskirts of Delhi, and we are planning to open another 15 more hospitals in the next 5 years. Cygnus is committed to ethically saving lives with dignity, affordability, and quality. It is actually a fireable offense in our company if we turn away any patient due to financial considerations. So we will treat all patients regardless of the fact that they are able to pay or not. My initial budgets would be, okay, this month I can buy a glucometer because that is 1200 rupees, so I'll buy it. And nebulizer is 1500 rupees, so I can't afford it, so I'll buy it next month. This is how we started with our hospitals, and started off with one very small one. Then luckily good people joined on the way. We got good backing from people who put their money behind our efforts. Right now we have about 1600 people working for us across our 10 hospitals and our offices, and we've treated more than 2 million patients till now, and we've done more than 50,000 life-saving surgeries. That is some numbers that we're really proud of.
Now, there's a much longer version of this video, and there's also the podcast interview I did with Shuchin, and he now has his own media platform where he's sharing messages around how it's important and what are the initiatives underway in India to really address this population group where they just can't afford healthcare. And how do you provide primary, tertiary, secondary, and tertiary care to these individuals? Now, Lynna, what was your reaction when you first saw Shuchin's story?
Thank God for doctors like Shuchin, that he still exists among us. And I think the second thought was, how can we clone him? But more seriously, I think people die before reaching care, Tony. It's a story that we hear over and over again in Indonesia, in the Philippines, and many parts of Asia and Africa. These people become numbers, if at all, and faces we don't see, therefore forgotten. But each of these people who died because they cannot reach care or have no available care near them is someone's father, someone's mother, or sons and daughters. So Shuchin's dedication to the people he serves shows us that if the heart is awakened, compassionate care, and let's use his words, dignity, affordability, and quality care can be made available. That it is a fireable offense to turn people away due to financial considerations. And I celebrate that, right?
Yeah, and look, I think that when it comes to trying to figure out how do we take these stories of compassion and bring them into our daily lives as entrepreneurs, as investors, as global business leaders, there is a balance that has to be struck. What Lynna didn't mention in her introduction is she was an investment banker in her first stage of her life. And your background is a starting point for why you are in healthcare in the first place. But I would bet that, let's just take a quick poll. How many people are in healthcare because something motivated you from a family member? How many people are working in healthcare because something happened in your community and you wanted to make a change? How many of you are in healthcare because you saw something that needed to be fixed and you started on a journey to fixing that healthcare problem? Right? So there's many, many stories that each of you have. And the H's for humanity starts with our personal motivations and building on our expertise and skills, and then growing that to bring compassion into the way that we work. Now, Lynna, when you and I were talking about this session, we started talking about frontline workers. And Shuchin and his organization is one example, but all over the world, even in Europe and the US, this isn't a developing country issue. And you brought up a phrase that was really interesting that still resonates, is that there was a war. There was a war, and the frontline workers are just coming through the other side of that war. Can you comment on your thoughts on what that means and what we should be thinking about and how we now have a new way of considering what these people have gone through?
I think we were talking about the pandemic at that time, Tony, and how, as in a healthcare group like Rachel House, how do we feel about that? For us, it feels like we have just come through a war, that everything around us has been left in tatters. But one thing remained absolutely clear, that the pandemic has shown us that no matter who you are, wherever you are, the knowledge that somebody is beside you when you are suffering, when you're in pain, it's a core hope in all of us. At Rachel House, we were the only home care left in the city of Jakarta for the poor during the pandemic. And our nurses and our community health workers went out. But the continuous voice that we heard was, I'm so glad you're still here. Even if you're just at the other end of the line, that we know somebody's got our back. We're not alone. We've seen how the pandemic has disrupted the entire healthcare structures and left so many institutions in tatters, maybe not in physical way, but in emotional ways. But I hope through this, we can hope to build a new structure where we have collaboration and care woven through its DNA, and care professionals and patients work together, and that between care providers and communities, that we work together so that people are not left alone, that everyone is assured that somebody has got its back, whether we train community health workers or our neighbors or healthcare professionals. And if we have that, then layering digital innovations that all of us are here today on top of this healthy and fertile soil will hopefully build a health system that we know with hands on our hearts we can entrust our loved ones with.
Yeah, and I think that building on that comment, I love the slide that Roberto showed earlier about how we're moving to a digitized first healthcare system and all the trends that are shifting, supported by AI, supported by various types of technology that are really helping to improve efficiencies, really helping to create ways of reaching people in remote areas like in 17,000 islands in Indonesia, or in rural areas in places like the US or in India, which both have the similar challenge like this. But on top of that, Kai-Fu Lee is an author who wrote a book about the AI race happening between China and the US. And one of the conclusions that came out of that book was that AI as an enabler doesn't replace the empathetic care that people receive from that emotional connection from a clinician. And that's the part that won't get replaced in healthcare. And so that's something that, in Rachel House, where you deal with the end-of-life people and hospice, or dealing with hospital care, we need that emotional connection.
That's so true. I think in the end, when we are in our beds and suffering, and people are rushing around us in the healthcare, so often that we see in hospital, it takes only one person to turn around and ask, how can we help? How are you doing? And we've seen so many times that, research has shown that people need just that one question and the certainty that they're seen, they're heard. So while we have this modern science discoveries and everything else, let's not forget that our humane and our human person deep within us still crave to be seen and still need to actually know that someone is beside us. Yeah. So it's so true, Tony, let's not discard the humanity side while we build the science part.
Yeah, and compassion is at this core of humanity. And this has been a really good introduction to this conversation, Lynna, and I think that at the same time, we also have to recognize that we're in an event and in a conference where we're here to figure out how to collaborate and co-create together. We're here to find that next great group of individuals building a new platform and a new startup. We're trying to change markets. And so, Lynna, you and I both spend time on boards. Question for you and how to make this actionable is, if you're sitting in front of a board or the investment banking conference that you were just at, what is something actionable that you give as advice to people who are business leaders trying to create better businesses so that they don't forget about the social good?
I think we talked a lot about this when we met last, Tony. Let's imagine how we enter into a care. We enter into care where we, as a patient, where somebody takes our data. And then somebody, as an older person, perhaps I have comorbidity, I start seeing different doctors. And each of these doctors will actually prescribe something for me. But as an older person, I don't remember them. And when I go home, I may take different medications and their contraindications. But if there is a care coordinator that basically remembers, and if there is an AI that basically records everything, and that when my nurse and home care nurse comes, she can actually, she can actually see what are the medications, or even advise the doctor that there's contraindications. What I'm trying to illustrate there is that each of us create different structure. Even in healthcare, we are so siloed. But perhaps in the digital world that we now create, can we work together? Can we coordinate so 1 + 1 = 11? That patient at the end, the user, becomes still our focus. That we can imagine our mother, my mother, 80-year-old mother, walks through that service and the entire health system, that somebody is coordinating that care. If we can put my mother and our mothers in the center of our creation, perhaps we will be more willing to work together and understand that it's only when we work together that dots connect.
Yeah, I love that.
And we create a huge system and better system for all.
Yeah, I love that notion of working together. I describe that as building the right ecosystem to solve common problems together and putting compassion at the center of it. We have a couple of other talks during the next 2 days around this topic. One later today where we'll be joined by Rachel Frisberg from Roche, along with 2 entrepreneurs from Prava Health and from Altibi, to have a conversation about health ecosystems building on top of telehealth. And then tomorrow we do have a master class as well around public health and innovation. What are some of the case studies and lessons learned that we can pull away from that? We do have an ask from everybody in the audience, which is that, as you introduce yourselves to each other, and you're getting to know each other, start first with, why are you in healthcare? And before we get into that conversation of what can we do together, because it's just a wonderful way to really remind ourselves day in and day out that that's the reason for compassion. Lynna, we're almost out of time, so I wanted to say thank you so much for joining us. It's been a real pleasure to hear your story. Round of applause for Lynna. And as my last point, this is an ongoing conversation. One of the things that I'm doing is I'm working on a new book around the mindset shift required to address health inequality. If you're interested in learning more, just come find me. Happy to talk to you more about it. I will see you all later today and tomorrow at various other sessions or just networking around. Thank you so much for keeping the H for humanity top of mind.